And I would like to introduce next speaker, which is Michael Fehlings from Toronto. Please, Mike.
Thank you, Eva, and thank you for organizing this wonderful symposium in this beautiful venue. So each of the speakers is going to present a little bit of a different angle on a similar topic, and in reality, it's likely that stem cells will need to be part of a combinatorial strategy to tackle spinal cord injury. But I'm going to focus mainly on neural stem cells and mainly on the idea of inducing remyelination, although I'm going to talk about some other strategies, in particular a combinatorial strategy with chondrogenase to enhance plasticity and reduce glial scar. So greetings from Toronto. And I wanted right at the outset to acknowledge my students and collaborators. And the reality is that I owe them very much in terms of the progress that we've made. And James, you'll recall this photo from a few years ago when you were in Toronto visiting us. In addition to doing a basic science work with neural stem cells, I'm a practicing neurosurgeon, and it's always a harsh reality when you look after someone with a spinal cord injury. This is what it looks like. This is a young person with a diving-related injury, with a fracture dislocation at the C4-5 level, major injury of the cord related to both an acute contusion, ongoing compression, or ischemic changes within the cord. So I was going to talk mainly on neural stem cell transplantation, a bit about the rationale, some of the options, different ways to generate these cells, introduce the concept of remyelination, and then present some initial published work with a new cervical model, which we've been working on. And then at the end, just in the last few slides, perhaps touch on the challenges related to trying to translate this into the clinic. It's a very difficult and daunting challenge. And I believe that Dr. Kocius is going to actually present some interesting work in stroke. So Eva very nicely talked about spinal cord injury. And these are, again, some pictures of MRI of a human patient with a spinal cord injury. The middle is actually a cadaveric section, post-mortem section from a young person who died. This quite graphically illustrates the compression related to cord injury. And Eva talked about the vascular changes. Here's hemorrhage in the spinal cord with the surrounding area of ischemia. Bottom right, this is a chronic human lesion, and it illustrates the loss of cells, cyst formation, the surrounding glial scar, and so many of the challenges and concepts related to the repair of the injured spinal cord. And of course, we have many different options, and some of these are autologous, and some of these are not. We're going to focus on neural stem cells as a potential strategy. Eva also touched on the different ways that stem cells might work. They might be protective in terms of tissue sparing, to replace lost cells, and potentially to modify the environment. But it's likely that neural stem cells do all three, although some emerging evidence from our laboratory would indicate that, at least in our paradigm, that remyelination appears to be the dominant mechanism by which these cells work. So the underlying concept is just illustrated in this video. So here we have the normal spinal cord. We have myelinated axons that conduct action potentials. These action potentials are fired at the nodes of Ranvier. The oligodendrocytes make the myelin and sheaths the axons in the internormal regions. One has a precise molecular organization of these axons with molecules such as Caspar and then potassium channels in the juxtaparanormal region. In the setting of spinal cord injury, there's a necrotic core that occurs, and there's a partial sparing of white matter in the subpial rim. There is extensive apoptosis that occurs. This predominantly involves oligodendrocytes in the subpial rim. And as a result of this, there's demyelination, incomplete remyelination, and there are many axons where there's disruption of the normal molecular arrangement. Particularly, there's upregulation of these potassium channels. So you get conduction block. And so the concept here, with neural stem cell strategies to use the endogenous cord as a scaffold, if you will, to go in with the neural stem cells, try to drive them along an oligodendroglial lineage, and then allow them to track along the white matter and to try to induce remyelination. And although the video perhaps idealizes this, there in fact is quite good evidence to support this mechanism. So that's the underlying concept. So where's the reality? So first, in terms of just talking a little bit about the strategy that we've been using. So when we set out to start trying to apply stem cells, I made the decision to try to go with what I thought might be the ideal stem cell type, as a committed neural stem cell, and then figure out ways to try to generate this. So this has been our strategy. We've taken advantage of the discovery by Sam Weiss and Reynolds in the early 90s that there are neural stem cells in the periventricular region. These are isolated using the neurosphere technique, expanded in culture, and then we have a population of committed neural stem cells. And more recently, we're starting to use induced pluripotent stem cell approaches, and this is taking advantage of the discovery by Yamanaka, of course, in terms of the introduction of various transcription factors into somatic cells, as well as an approach that we recently published on in collaboration with the Vanderpoel Laboratory, and that is using what we're calling the default pathway. This is actually a much simpler way to try to take a population of either pluripotent ES cells, which is what we published on here, but now we're actually applying this with IPS cells, and using LIF and then FGF2, we can actually then derive a population of what we call definitive neural stem cells. These are multipotent committed neural stem cells that will only make nerve cells in culture. And then putting this together, where we're going with this now is taking advantage of discovery made by Andras Nagy in our group in Toronto, published in Nature a couple of years ago, where rather than using viruses to deliver the transcription factors to make the iPS cells, we're using a non-viral technique using piggyback transposons. And so the beauty here is that one can then cleave the piggyback transposon cassette and really not have any signature of related to the introduction of these transcription factors. And using this, we're now able to derive neural stem cells.